What question do we ask ourselves in order to know, should we treat this patient now versus should we wait until later and do it in a comprehensive phase? So if everything on the problem list, if we can correct it later and get just as good of a result, then there's no reason to treat now. And so that's how we have to evaluate. It becomes very clear whether or not you're going to recommend treatment based on that question. So we go through it. So crowding, early loss of upper left D. If we don't treat the crowding early loss of upper left D, will something bad or is something bad likely to happen later or no? And sometimes you can be on the fence about it. Well, what bad could happen with early loss of upper left D if we don't do anything? Space loss, right? Continued space loss. We already have a little bit, right? So if we have additional space loss and that those molars migrate additionally more forward, that could create an orthodontic challenge, which could cause either one of a couple things. If it was severe, you might have really severe crowding, in which case you would have to possibly extract one of the permanent teeth on that side, or maybe place a TAD and distalize that side. Or if you try to treat it traditionally and you're opening up space on one side, not the other, the maxillary midline might shift. And so if we leave that untreated, there's definitely some things that could happen that could make the result less ideal and or may necessitate additional, more aggressive or more risky treatments later. So when we're looking at space loss of the upper left D, that may be something that we want to address. Now there's lots of ways to address that, right? We could just throw a band-in loop on there. So for that problem specifically, at least I'm going to recommend a band-in loop or a retainer or some type of something so we don't lose additional space. We're recommending some sort of phase 1 for that problem.